TB, HIV care and South Africa network of people who use drugs, along with the Deputy Minister of Social Development, Hendrietta Bogopane-Zulu, Deputy Minister of Health, and Dr. Mathume Joseph Phaahla will be holding a World Hepatitis Day Advocacy and Training Roundtable tomorrow to help drive efforts to eliminate viral hepatitis as a public health threat in South Africa. Globally, 325 million people are living with viral hepatitis, and it causes 1.4 million deaths per year, more than HIV and AIDS and malaria. In South Africa, 3 million people are living with chronic hepatitis B virus and infection, and between 400 and 800,000 living with chronic hepatitis C virus. For more, we speak now to Professor of Medicine and Hepatology at the University of Cape Town, Dr. Mark Sonderup. Thank you so much indeed for joining us, and welcome to the program.
Hi, thank you for having me.
All right, so, you know, hepatitis, to be honest with you, I think a lot of us are pretty ignorant about it. At one stage, I thought it was just a sexually transmitted disease, but it's so much more than that, and there are different strains.
Yeah, no, absolutely. I think you're probably starting off on a great note, because the biggest issue that we battle with is really an issue of awareness. And so tomorrow being World Hepatitis Day, I think the public at large need to see it kind of in the same ilk as we see World AIDS Day every 1st of December. And World Hepatitis Day has been set aside by the WHO for well more than a decade already. In fact, trying to start this process and conversation towards greater awareness. And you're quite right. Viral hepatitis is a range of viral infections that all, to a greater or lesser extent, produce inflammation of the liver. The two we struggle with the most, because they are the ones that, if you're infected, you run the risk of not clearing the virus and it becoming chronic. And we've made things simple over the decades. We name them after the letters of the alphabet. And the two we struggle with, and I'm referring to, is hepatitis B and hepatitis C, as you've just mentioned in your introduction. And you're quite correct. For viral hepatitis B, for example, sexual transmission is a potential route of transmission, but unfortunately it's not the one that dominates in sub-Saharan Africa and South Africa. In fact, the commonest time of exposure to hepatitis B, in fact, is in childhood, and it dominates in child-to-child transmission before the age of 5. But adults are at risk, and it can be a sexually transmitted infection. Hepatitis C, of course, is transmitted through blood-blood contact, and really it's an infection that has occurred historically in people receiving blood or blood transfusions prior to us being able to test for it in the early 1990s, and it's largely been eradicated from the blood services because of excellent testing. And nowadays, what we're seeing it in is a growing population of people transmitting the virus through the growing burden of injecting drug use, or people who inject drugs. And certainly in South Africa, Peter, you know, we're not immune to that. This is a growing social problem. Unfortunately, with it comes the growing issue of transmission of hepatitis C. And we have a significant burden. You know, we have populations that we've shown in studies over the last few years where up to 3/4 of injecting drug units, for example, in the city of Tshwane, in fact, are infected with chronic hepatitis C virus infection. And those rates are about 40% in our coastal cities. So this is not an inconsequential problem. It's something that is there, unfortunately, terribly silent, terribly misunderstood, terribly stigmatized. And we kind of feel in the hepatitis community, we're sitting where our colleagues and HIV activists sat almost 3 decades ago. But we don't have time. And that's why tomorrow's slogan is hepatitis can't wait. We need to do this now. And we need to start the conversation and awareness.
And I would imagine, with the way that we drink in South Africa, alcoholic hepatitis is also a concern.
Absolutely. And again, you're absolutely correct. I mean, the term hepatitis is just really a broad term. It means inflammation of the liver, and there are many, many causes. Viral that we have just been talking about now is one such cause that, the reason we're having World Hepatitis Day tomorrow is because there are good tests and potentially excellent treatments available. But alcohol, of course, is another issue that also causes inflammation and damage to the liver. And in fact, globally is one of the 3 or 4 biggest causes of liver disease globally. And we're certainly not immune to that in South Africa. So alcohol-associated liver disease and hepatitis is certainly another problem we encounter as well. But of course, equally, the remedy is in simple terms easy. It's stop drinking. But of course, the action and doing that and getting people to change their behavior and relationship with alcohol is somewhat different.
I mean, I was reading an alarming statistic that somebody is dying every 30 seconds of a hepatitis-related illness. So for sure, we can't wait. How much of this can we prevent just by changing our lifestyles?
Well, if we're talking about viral hepatitis in particular, the actual viruses and the viral infections we've just been sort of chatting about, then I think maybe we should start with hepatitis B, because perhaps that's where the biggest challenge is for us as a country and certainly as a subcontinent. I think it's important for the public and for people to realize that sub-Saharan Africa, together with Southeast Asia, really is the epicenter of the global epidemic of chronic hepatitis B virus infection. The vast majority of chronic infections globally, in fact, occurs solidly within those 2 regions of the world. And as you mentioned in your introduction, about 3 million South Africans are chronically infected with hepatitis B. The important thing is that since about 1982, we've had an enormously successful and available vaccine for hepatitis B. Now, as a country, we introduced that vaccine into our childhood and what's called our expanded program for immunization for children. We did that in about April of 1995, and we currently offer children 3 courses of hepatitis B vaccine starting at about 6 weeks. That's been going for well more than 2 decades and has in fact been enormously successful in driving down our prevalence of hepatitis B in people who've been born after 1995 and received the vaccine. And this is, of course, a highly topical issue. Vaccines are highly topical at the moment, given COVID. So I think this is a great time to have this conversation. Unfortunately, the one thing we do need to do, and policy that has been driven globally and adopted by many countries globally since 2010 already, is the need for introducing something called a birth dose of hepatitis B vaccine. Because the first shot we actually only give kids at about 6 weeks, and we need to do it at birth as well. And there are only about 12 countries in sub-Saharan Africa doing that. And we're unfortunately one of those countries who've yet to do it. We were due to start about 2 years ago. COVID has set us back, and some funding issues has set us back as a country. So what I'm saying is that hepatitis B is eminently preventable through vaccination, incredibly effective and preventable through vaccination. So that's the port of first call. But there are many people walking around born pre-1995 or who haven't accessed vaccination adequately who are chronically infected. And those are people we need to identify. And the next place you need to actually target is women when they're pregnant. All women in South Africa currently are screened for HIV and for syphilis as part of routine antenatal care. We need to add hepatitis B to that and offer pregnant mothers very special intervention to absolutely make the transmission of hepatitis B to babies zero, because you can, through proper birth dose vaccination and some relatively easy interventions, you can drive that to zero, because prevention is better than cure, always. And so that's an important intervention, and that can no longer wait. We need to do that. For hepatitis C, Peter, what there is there's very effective therapy available, curative therapy. People can literally take a tablet once a day for 12 weeks now. They can be cured of hepatitis C. And so enormously this is a wonderfully good news story we have. It's just that awareness is lacking. It's almost these are Cinderella infections that need to come out from the darkness into the light, so that people are aware of it, can get screened if they're concerned, and access the proper care, and really just get on with their lives, basically.
Are any of these viral hepatitis conditions contagious?
Well, all these viral infections are potentially infectious and transmissible. And that is why people who have got chronic hepatitis B virus infection can unwittingly transmit the virus to other people. As I said earlier, in adults, sex contact and sex transmission is possible, or sharing of body fluids, needles, tattoos, etc. Those are potential sources of transmission. But simple touching, kissing, etc., like that, and simple ordinary contact, that's not a source of transmission. With hepatitis C, of course, it's sharing of injecting needles that is probably driving the commonest source of infection now globally, and in our own backyard in our country as well, as we've now established. So yes, to answer your question, it is transmissible, but through specific routes of transmission. And those can, of course, be shut down by identifying infected people, linking them to care, and vaccinating people at risk.
Is it possible that sometime in the future that there'll be no hepatitis in the world?
Well, I hope to have that before I retire one day. And I'll retire a happy person. So the answer is yes, because we are on a path globally and individually as countries around the world on hopefully paths towards what we call the elimination of viral hepatitis. Because when you have potentially very good therapies and you have potential prevention through highly effective vaccination, that combination does give you the opportunity of elimination. In a sense, we're trying to do the same thing with HIV globally as well. The one thing lacking in that equation, of course, and remains elusive, is an effective vaccine. But therapies are highly effective. And we know with HIV, undetectable equals untransmissible. So these interventions are possible to eliminate these chronic infections. And yes, we've set aside ideally 2030 as the goal to do this. Now, what we need to do is roll up our sleeves and get working, because, that's 9 years away. So the answer to your question simply is yes, but it's going to take work, it's going to take commitment, and it's going to take a fair amount of resource allocation to achieve that. But then what you achieve effectively is a generation free of these illnesses that, of course, in a sense, lift the burden on your healthcare system in perpetuity. And what the WHO has advocated, and something that South Africa is slowly adopting, which really is a sensible approach, is what we call the triple elimination. So through leveraging on your resources you have in your healthcare system and not working in a silo fashion, you try and go for individuals getting packages of screening and care for HIV, syphilis, Hep B, Hep C, etc. And then you target individuals at the point of care and offer them the correct care and link them to care appropriately. And that way you try and use the best bang for your buck. And I think that makes sense, and that's the way many countries are moving.
All right, we're running out of time, but perhaps briefly, tomorrow, as you say, a lot to do with awareness. Is it something that we should be testing for as standard? Because I guess some people might live with hepatitis asymptomatically for a good number of years.
That's the problem. The problem with viral hepatitis is by the time you get sick, it's almost too late. And both chronic hepatitis B and C are very much silent infections, and they are asymptomatic. And so, for example, if you fall into potential risk categories, if you've ever used injecting drugs in your life, if you've ever had blood or blood transfusions prior to 1992, for example, you should actually consider, as part of health screening, you should consider a screen for hepatitis C, for example. As for hepatitis B, given the high background prevalence of hepatitis B in South Africa and in sub-Saharan Africa, it should actually be part of routine health screening. And for example, as I've indicated, if you're going to target a particular group to start with, pregnant mothers is the place to do it, because there you'll be screening both the adult individual and preventing transmission to the baby.